Hello friends, welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. Now, people who suffer from facial paralysis from various stages have day-to-day life challenges. Yes, there are a lot of things that affects their quality of life. These are some of the challenges which make their day-to-day life very difficult, and they sometimes get confused how to resolve them. So in today's video, what I'm going to do is I'm going to share with you top 7 daily life challenges that people suffering from facial paralysis either in the early stage or in the later stage go through, and I'll also give few tips on how to resolve them. So if you are interested to know that, make sure to watch this video till the end. Let's begin. So friends, when a person suffers from facial paralysis, be it an acute facial paralysis or a chronic facial paralysis where even they have developed synkinesis, there are few signs and symptoms that they will experience on their face. This signs and symptoms makes their ability to do day-to-day tasks difficult. These day-to-day tasks are super important and are like natural things which becomes absolutely difficult. And one such thing that becomes very difficult is blinking. Now, we don't even think when we blink, right? It's an automatic natural action. But due to facial paralysis, this blinking activity gets impaired. Now, what happens with this? When you are in an early stage of Bell's palsy, your blinking does not happen because your face muscles are paralyzed. Now, when this happens, what will happen? You will feel a lot of irritation around the eyes, watering will start, and all these issues will happen. At the same time, when people suffer from chronic facial paralysis or synkinesis, at that time also, they will observe that while blinking, one side of the eye is slower compared to the other side. Even in that case, it becomes very difficult and constant attention of patient goes there that my eye is not blinking properly, and that increases overfiring of neurons in the brain. Now this is a very common challenge. So now how to improve the blinking action? Well, there is no straightforward way to improve the blinking action, but one thing that you should definitely do, especially when you are in early phase of Bell's palsy, is to stretch your eyelids every 2 hours. This will make sure that you don't develop contracture on this eyelid, which is one of the biggest complication or a problem that people experience. That is one thing. And the second thing that you have to do is you need to make sure that every 2 hours you give some rest to your eyes, because your eyes are constantly open and this will cause a lot of irritation and also will affect your blinking action, right? So this muscles very easily get tight, very easily gets tired, and it leads to further problems. So make sure rub your hands well every 2 hours and also relax your eyelid muscle. That takes me to the second thing that you should do that takes me to the second problem that commonly people face when suffering from Bell's palsy, and that is tearing from eyes. Yes, water coming out from the eyes. Now, watering from eyes can happen in the early stage of Bell's palsy as well as in the later stage of Bell's palsy. In the early stage of Bell's palsy, when watering from the eyes happen, this is because of incomplete closure and dryness of the eyes. But in the later stages, this watering happens following synkinesis. Yes, there could be a synkinesis of your lacrimal gland as well, which means whenever you smell something related to food or whenever you are chewing something, at that time eyes can water. Now, in both the scenarios, the solution is different. Now, in the first scenario, which I said in the early stage of Bell's palsy, where you are experiencing watering from the eyes, at this stage, it's because of dryness. So, to solve it, you should apply your eye drops on a frequent basis, that is every 2 hours. And before you go to bed, apply eye gel that your doctor would have prescribed. Also, make sure to tape your eyes properly in order to make sure that the eyes are well closed, well lubricated. So, when you wake up in the morning, your eyes are fresh. Now, on the second side, when it's about synkinesis, directly we cannot do anything about reducing the watering from the eyes due to synkinesis, but we can reduce or else we can minimize the frequency of that by first making sure whenever you're chewing your food, take small bites of the food. Don't grab and try to make a bigger bite. Second, try to chew the food first on the normal side and then you can shift it on the other side and then you can gulp it. That might reduce the level of symptoms. Third thing, whenever you are chewing and watering is happening, either you can keep your eyes closed like this while chewing, or else you can look upward and outward so that the chewing action is constantly going on. There is no extra stimulation happening here and you will have reduced eye watering. At the same time, you should also see an eye specialist because there are few procedures which can help you out to reduce that excess watering happening. So that's the role of an eye specialist doctor. So make sure to see them. That takes me to the third common challenge in life of a person suffering from facial paralysis, and that is constant feeling of pull in face. Yes, now again, when a person is in early stage of Bell's palsy, the pull is felt in the downward direction. The reason being the gravity is constantly pulling the facial muscles. But at the same time, as the time progresses and as the patient develops synkinesis, the pull starts happening in the upward and outward direction. What happens is brain constantly gets feedback that this side is weak. Now when this feedback is constantly going, since brain is absolutely normal, brain will try to release more and more neurotransmitters and will send these signals here. Now this signals overfire as your nerve gradually improves, and due to this overfiring, even while rest, even while doing normal movements, they will overfire and send signals around the facial muscles, which will give a constant sense of tightness on the face. In order to reduce these two things, at first place, if you are in the early phase of Bell's palsy and feeling stretch or else pull downward direction, give support to your face with the help of a belt, or else keeping your hand, or else applying a tape. But if you are in a synkinesis stage, then doing regular facial massage and regular facial stretches are the way to reduce this level of tightness or pull. Also make sure to keep yourself as much relaxed as possible. Don't force your facial muscles to contract, because they, even though they are weak, but they don't need over contractions. That will increase your synkinesis. So please don't do that. That takes me to the fourth problem. That is facial pain. Yes, facial pains are also even common. I get many patients who say that whenever I sneeze, whenever I shout, or whenever I talk for a long period of time, I feel pain around my cheek region or else behind my ear. Again, this is due to over contraction of the facial muscles, and facial muscles get tired and then they start sending signals of pain. So if you want to avoid that, what you need to do is, again, avoid speaking, shouting, or eating very strong food which requires a lot of oral activity. Try to keep them as gentle as possible. Second, apply hot fermentation to the face at least once in a day, and do a lot of facial massage. That will help you to reduce the symptoms of your facial pain and issues around it. And that brings me to point number 5, and that is difficulty in smiling and laughing. Now, many people have this one wish, one desire after suffering from Bell's palsy, and that is that they want their smile back. Yes, smile is one of the most precious gift of human being, and that gets lost when a person suffers from facial paralysis. And this smile is the most important facial feature for a lot of people, and it's also a sense, or it's a source of communication, and when it gets affected, it impacts your quality of life. Now there is a study which also says that when you are not physically able to smile properly, you don't even feel the smile. But at the same time, if you feel the happiness from within, automatically your smile muscles will activate. So if you want to smile, try to smile naturally. Don't laugh. Don't try to force your facial muscles to do this. Instead of that, spend some time daily keeping your eyes closed, remembering your face before Bell's palsy, or else remembering anyone whom you feel loved or whom you like, and you can just recall that person and you can smile, and then try to do gentle smiles by actually feeling that happiness like this. This will make sure that your right smile muscles are activating, and on a very gradual basis you will definitely see improvement in your smile. That takes me to point number 6, and that is difficulty in yawning. Yes, yawning is also involuntary action, right? Like we don't think, it just comes, right? Now whenever we are yawning, our mouth has to open wide. Whenever the mouth has to open wide, it puts a lot of stress around the cheek region, around the eye region. Now this is something which should be avoided completely, whether you are in early stage of Bell's palsy or you are in later stage of Bell's palsy. In either of the cases, over contraction of the facial muscles will happen and will lead to over tightness and pain, etc. So the best way to do is, whenever you feel yawn, immediately cover your mouth with your hand. Don't allow your facial muscles to open wide. That will increase your synkinesis and could cause further problem. So make sure to do that. And that takes me to point number 7, and that is difficulty in speaking. Yes, there are few words which gives synkinesis in the later stage of Bell's palsy, and there are few words which people find difficult when they have to speak when they are in early phase of Bell's palsy. In both the cases, the reason, the oral muscles, the specific muscle which is around our mouth, is not functional. So words like O, E, F, B, P, these kind of words which requires this oris action is not functioning, and that's why you find difficulty in speaking. So ideally, if you are in early phase of Bell's palsy, the best thing I would recommend you, try to speak less. The lesser you speak, the better it is. Your facial muscles will get a lot of relaxation. But I understand we cannot stay without speaking. So when that is the case, make sure to speak less words. Make sure to speak in low volume, and make sure to speak slowly, so that whenever you have finished saying a word, there is a pause time given to the muscle, and then only move on. Most of the time, people who have habit of speaking fast, habit of speaking in a very high pitch, or habit of speaking with a very high tone, these people face difficulty in speaking more compared to the people who are more silent. So this is a very key small change which you can make in your lifestyle in order to reduce the amount of synkinesis and discomfort that you feel due to speaking. So these were my top 7 day-to-day life challenges that people suffering from facial paralysis experience, and how and some tips which will help you to overcome that. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.